All right. Hi, everyone out there in webinar land. If you can't hear this or if the sound is a little off, please let us know and we will make adjustments. So welcome to the first day of our wonderful webinar week at Vermont Family Network. We are very excited to have 3 webinars this week, and today we have Kathy Holsopple, the Executive Director from the Vermont Federation of Families for Children's Mental Health with us, and we also have Cindy Marshall, the Assistant Director from the Vermont Federation of Families for Children's Mental Health. And our topic of discussion is going to be coordinated services planning for children with complex needs. Just a couple quick logistics before I hand it over to them. We have a pretty large audience today. We have about 50 people with us. So for the sake of making it easier to get your questions answered, we just ask you to type your questions into the question box that's on your screen, and Kathy and Cindy will try to address these if they can along with their presentation, but might save some of them for the end. So if you can just wait till the end, we'll try and get to all of your questions. And at the very end of the webinar today, there'll be a short survey that is just asking some quick questions about the webinar, and if you could just take a few minutes to fill that out, it really helps guide our future webinars and it gives us feedback about how we're doing, so we'd really appreciate that. And don't miss our other webinars this week. Tomorrow we have Understanding the New Children's Health and Support Services. And on Thursday we have Vermont State Rules, the Use of Restraints and Seclusion in Schools. Also, just a reminder that all of our webinars will be saved on our website, and we also have hard copies that we can send out to folks if they would like them. So without further ado, here we go.
Hi, this is Kathy Holsopple, the Director of the Federation of Families for Children's Mental Health. Cindy Marshall and I will be bringing you this information this morning, and just wanted to give you a little bit of information about us and our organization before we start. Cindy and I are both parents of children, young adults now, with significant disabilities, and we've been supporting families for many years. The Federation has been around for over 20 years supporting families and bringing family voice with families to the system of care and the work that we do. So thank you for participating. Really appreciate this. This is our first ever webinar from this side of the computer screen. So we really appreciate your understanding. You may hear some shuffling papers and, you know, just a little bit of movement. We apologize for if anything is distracting, but we wanted to bring this information to you. At the end of the slideshow today, there will be contact information, so you can get in touch with Cindy or I, or get in touch with the Federation of Families. So here we go. Oh, okay. Sorry about that. This webinar is for families, so I wanted to just point out to everyone that this training is designed to provide families with information regarding how, why, and when they might benefit from a coordinated services plan. While we welcome professionals, some of your questions might not be addressed today. Please call the Federation for those answers or to arrange a professional training for your staff. So our goal is to meet the needs of all of our participants. So that's why we wanted to make sure that people understood that this was focused more for families. And I do believe this is one of the first bigger trainings around the state that we've had for families specifically. So what is a CSP and who can have one? I'm going to be switching this over to Cindy in just a minute to answer this question and some others. But I wanted to also mention just before I do that, that we're taking pieces from a full day training here. So we can only do an overview. We can't go into a lot of depth as we would in a full day. So our goal today is mostly just to help you to understand what is a coordinated services plan, why would you want one, how would it benefit you and your family, and then how do you get one. And again, we will have questions at the end, so feel free to ask your questions and type them in. Thanks. Here's Cindy.
Hi. We're going to start with a brief history of Act 264 and what that means and how that changed the system of care for us Vermont families. Act 264 was passed in 1988, and it gave families the right to have coordinated services with their children which have emotional disturbance, or what we would call SED, severe emotional disturbance. So, and that actually was an impressive and national law and set a lot of precedents actually nationally. And what that did was, it didn't necessarily mean that you were entitled to services, but it means that you're definitely entitled to the coordination of your services. And what we mean by coordination, we mean it's the right to coordinate them from your home services, your community services, and your school services. What we do know is an evidence-based practice, and there's better outcomes for families when you have coordination of all your services together, when all your services are on the same page, and everybody's talking the right language and has the same goals in mind for you and your child and for your family. So the success, built off of the success of Act 264, the Department of Education and the Agency of Human Services had an expanded agreement in 2005 for the same rights to coordination for other children with other disabilities. So that was a monumental thing. So when what Act 264 had actually done for families with children with social, emotional, and behavioral and mental health challenges, it actually created a statewide definition of SED, which means that the schools and the families and the private practices and the designated agencies, that everyone could come around and have the same definition of what SED was. Another important thing is that in all of our statute and too, they also mention at risk of too. So it really did open the availability to services to a lot of children who needed them and families. So Act 264 also created the coordinated service planning teams. It created local and state interagency teams, and it created an Act 264 advisory board, which we do know of that advisory board, 50 or plus more of those members are family members and consumers and people that have lived experience of the service system. So that's really, truly important. And they give, that Act 264 gives an annual report to the legislature and to the Agency of Human Services of what their recommendations are. And they do get input from service providers and families for those recommendations. So that's really important to know too. And what is one of the most important things that we feel is from families' perspective that happened with Act 264 is there's the creation of parent representatives as team members of both the local and the state interagency team. And your local interagency team, for those of you who may or may not know, is a leadership team that's consisted of your field service director of your local region, the Department of Children and Families, and also your education and your designated agency or your children's mental health division. So that's consistent. That is how your local interagency team is being built. And what is important that we feel at the Federation of Families is also that the parent rep is also part of that team. And a parent rep is actually a peer. It's a parent of a child with a disability who has lived experience with the services. So they're peers, they're families just like you, living the life that you are living, and they know and breathe and walk the walk that you have. So, and they're there to support you through the process. That parent rep can be at your coordinated service plan if you ask for it in advance. And you're also entitled to that parent rep a conversation with them, either by phone or in person, to a pre-meeting and a post-meeting, and it's really, really, really helpful. So I just wanted to let you know that. Okay. Here's another important key factor is your coordinated service plan, once it's done, is actually an addendum to your IEP. It's not your IEP, but it is an addendum to it. So, and also another important thing to highlight is that if you have a child that has qualified for special education under the emotional disturbance disability category, then every year you are entitled to your IEP meeting, you are entitled to, and you should be told every year that you're entitled to a coordinated service plan by statute. I don't have to quote the law, but it's there. And if they don't, you have the right to ask for it. And also, you could be calling the Federation of Families if you want to contact your parent rep. And I also would like to note that at your IEP meetings, you should be told that. And if not, you can call us, and then we can try to help you with that. Okay, so who is entitled to a coordinated service plan? Definitely through the Act of 264, it's any child with emotional disturbance, which means, and then children and adolescents are actually eligible for that, who, with the expansion, that receive any disability related services through AHS. So if we go to the next slide, there's a lot of disability categories for special education. So each one of those, it covers a lot of them. But just so you know, if your child's disability isn't on that list, you still may be qualified for one. So it's important to ask. Children on 504s with social with SED also qualify for a coordinated service plan too. Although it's if your child has a 504 and it's not has a SED, then they're not eligible. But it does cover pretty much all of them. So why? Why would we want one? Here's an important question. We get these questions for families all the time. It's like, why do I need this? How would this even help me? And why would I have to tell my story to a lot of strangers that I don't even know? And that's important. But here's some key reasons on why you could and why it would benefit your family and your team. There are some teams that are not coordinating. You have private insurance or private treatment providers, you have schools, you have your IEP goals that your IEP team. Okay, I have a question. This is an important question. So AHS, what does AHS mean? And AHS means the Agency of Human Services. The Agency of Human Services is a various amount of departments that are in your local region and in your community and statewide that have services. For instance, you have a local designated agency in your region that has children's mental health services and also has children's developmental disability services and also your Office of Childhood Special Needs. So there are services within your local neighborhood and your designated agency that you're eligible for. I hope that answers the question. So back to why. Why the heck would we want a coordinated service plan? So if your current team is not coordinating your care, so that basically means is you have an IEP team, you might have some private therapists, or you might have some private home and community-based services. or your designated agency services. You might be receiving respite. You might be receiving PCA services. You know, those are an example of some of those. But they're not, you have separate teams that are kind of doing all separate things, but they're not all really all on the same page. They may not all know the current information of how your child's doing or what your child's goals are. So this is a way for everybody to kind of have the same goals or working towards the same things. There's some complex issues that some of your teams, and I know this is really hard to believe, but some of your teams out there may not really work well together. And sometimes it's really hard to be that case manager type person, is to try to manage all of these things in different environments for your child. So this could be a tool for you to help kind of coordinate those things with a unified vision and some unified goals that you guys are working on. So also your team needs to get together to talk about unmet needs. And that's really an important conversation of if you might have had some changes in your the dynamics of your family, like a divorce situation, or you're having a new a caregiving parent move in your home or whatever, and some of your needs are going to change. You may have another child with another disability in your family, so things may change where you might have some unmet needs, and you want to convene as a team to see how you can get some more supports or different supports to meet your needs. Okay, and then even if your family feels, either you or your family member of your team feels that it would benefit your child, if you feel like you can get everyone in the room to have the same conversation, it would benefit your family and benefit your team, then this is a good way to do it, is a good mechanism and a good tool to do that. And this is not the only reason, but is mandated reason, is if your child may need residential treatment or a significant home and community-based wrap, or a significant about supportive changes, then you definitely would need to have a coordinated service plan. However, I have to tell you that it is required for, if you're having a residential placement request, it is required to have a CSP, but it's not the only reason to have a CSP. There's many, many more reasons to have that. And if you move on. And how do you get a CSP? How do you get a coordinated service plan? Well, what we recommend for families is you ask for one. If one's not being offered to you, you ask for one. And we always recommend here at the Federation of Families is that you ask your service provider that you have the best relationship with. So if you have a great relationship with your case manager at school, or a moderate relationship with your case manager at school, or if you feel like that's the best person to ask, then you ask them. And they are mandated actually to do that for you within a certain amount of time if you ask for it, especially if you ask for it in writing. But you can ask for them verbally or by email, and it still should happen. So I also wanted to say is if you have a better relationship with maybe a case manager, you have a case manager at your local designated agency, you can ask them too for your CSP. And if this shouldn't happen, okay, but if it does so happen that you've asked people for a coordinated service plan and they didn't follow through with your request, then you definitely could call the Federation of Families and we could move that forward for you. Make sure that that happens. But it shouldn't happen, but if it does, give us a call. Okay? And how do you prepare for a coordinated service plan? Now here's an interesting question. Is what we would like to do and we encourage families to do is you would prepare for that in many different ways. What you might want to consider is calling a parent rep and having a parent rep with you at your coordinated service plan, and that you're entitled to that actually. So, but you don't need it, and if you don't, and if you have a natural support system or you have other supportive people in your family, then you can actually invite them too. It doesn't have to be your parent rep, although we have found that they could be beneficial. Those parent reps out there that do know the system, they do know what services are available, which ones you may or may not be eligible for, and then they can help you advocate for them and ask those hard questions too during the meetings. So it is beneficial to have a parent rep there. Let's see here. One of the key things that we have families do is review the paperwork before the meeting. And Kathy's going to actually review this in a few minutes, so I won't get into full details about the paperwork, but having that paperwork ahead of time and reviewing it and knowing what the questions that are being asked of you ahead of time is really, truly important, because it gives you time with your family, your husband, your significant other, and actually with your child too, is ask those important questions. You know, what would make you feel safe, and what are your dreams and your hopes and your goals for you and for your family and for your child. Sometimes when you're asked those things last minute, you're really not prepared to answer those questions the best way possible. So it's easier to get your just to get your answers to your questions ahead of time. And also, it's for those children with youth in transition and your children that are old enough to answer those questions, it's really important that you answer them for yourselves and then help your child answer them for themselves. And then you can bring that information to the sorry, I'm trying to do two things at once and I'm really not good at that. I apologize. And we do have a question. Someone has lost audio too, and I apologize. So I just wanted to let you know that. So reviewing the document is really, truly important, and supporting your child to answer those questions too. And you bring those answers to those questions from your child's perspective and from your perspective. So they're really, truly looking at a formalized plan, looking at your family holistically, and not really just with the focus of what the child needs. And it's also, too, that brings me up to one little important thing is if you feel that your child could go through this meeting, we've seen it and we've supported families that have actually had their youth maybe participate in the beginning part of the meeting and maybe not the whole meeting, but did answer the questions for themselves and answered and provided the answers for the team. And so now what can you expect at a meeting? Well, we've seen meetings done in very different ways, but they're all consistent with certain elements. I've seen the facilitator of a meeting have a lot of big sheets, posted sheets up on the wall, and you have those questions, and you get a group answers to the questions. You always ask the family to answer those questions first, and then the youth, obviously, if they're in the room. And then we go around and we get from service providers that you have invited there and that they have been there because they're serving your child in some certain way. Examples could be like Voc Rehab people, maybe post-adopt supportive people for those in those cases. So you will have familiar faces at your CSP meeting. It shouldn't be a big surprise to everybody, but getting everybody in the same room is really, truly important. If we move on to who's actually going to be there, each one of your service providers from your child should be there. By law, what has to happen is you have your educational people represented, DCF represented, and your designated agency presented, so your community-based services. Okay, I just want to tell you that you can request that DCF not be there, and what I mean by DCF is protect the Agency of Child Protection staff. So, but I actually have seen them in certain complex situations be very, very helpful in being part of the team. So you have your right to say that they're not there if you don't want them there. But I also have seen them there in a very proactive way be really, truly helpful. There is some funding there that they can offer when it's really not when it's not a child abuse or neglect situation. They do come to the table with some good resources and ideas. And these meetings can be difficult. You're actually talking about, especially if you're in crisis at that moment, or you're talking about some really complex issues happening in your family. And it is really, truly hard to say all these things. We do know that say all these things that are happening in your life. What are your most biggest challenges and your biggest fears and your deepest dreams for your child. These are a lot of intense and important questions to answer, and it's really hard. So I really do encourage families to bring a natural support person to those meetings, but also be considering bringing your parent lit rep also. And one of the, I have to go on in saying this, I have to go on record, is sometimes the conversation does twist into what are the services that are needed that are not necessarily, there's no funding priority, especially if you have a child with a developmental disability. It's not uncommon to be having a conversation of what your child actually needs, what your family actually needs with supports, and there's really your current situation or your child doesn't meet a funding priority, unfortunately. And so funding issues do come up. And it's unlike in your IEP meetings, whereas they really can't legally say and talk about them. It will be part of the conversation here, and it will probably be a difficult part of the conversation, but it's important to talk about it and move on. There are it's also important to know that if you discuss in a CSP meeting that there are needs, specific needs for your child and for your family that are needed, and there isn't a funding mechanism, that we as families are always open, and we can be looking for additional grants to provide for those services too, just so you know that if there's don't be closed-minded, I should say, around talking about what it is that your family needs, and then you figure out how to fund it in various out-of-the-box ways. But definitely be talking about it and putting it on the table and making sure that it's documented of what you've requested and what you feel that your child or your family needs at that time. And now I'm going to turn it back over to Kathy.
Hi. We're going to now look a little bit at the Coordinated Services Plan form. And this form has been updated a few times, but it really is a crucial piece of understanding this process, because this is where the important information comes up for families. I wanted to mention that Amy here from VFN sent all participants copies of the form, as well as a brochure about parent reps, so you have an idea of what the parent reps can help you with. And if you didn't get those forms or you didn't access them before this, and you don't need them to go through this today, just know that they're there, and they could be helpful for you at a later time. So I want to start off by saying that the way I sent the forms to you is in 3 different documents, and there's a reason for that, because the Coordinated Services Plan forms have 3 distinctly different portions. The first one is the only part that is the main part that we use, and it's only 8 pages to do a coordinated services plan. If you look at all of the documentation together, all of those forms, it looks overwhelming, but for a coordinated services plan, we're only going to use the first 8 pages. The other pages are for referrals to LIT and SIT. That's the local interagency team or the state interagency team. And then the third section is for referral for CRC, or the Case Review Committee, which talks about children who may need residential treatment. So let's move this forward. I think I'm going the wrong direction. I apologize. Sometimes it's hard to coordinate the hands and the mouth at the same time. Okay, we're looking now at page 1 of the Coordinated Services Plan. And we're not going to go through most of what's on here. Again, I just want to point out some highlighted piece. You can find these forms also at the blog spot, and that's another thing at the end of the slides. The last slide will have that information on it as well, how you find that on the internet. Second page. Just the important thing to note here is that this is signing permission only to have the meeting. It's not signing permission to give away anything, to take on anything, to say you agree with anything. It's just saying that you are here and that you're signing in that you're giving permission for this meeting to take place. It's also a place where you can sign into, it talks about the contacting the parent rep. And again, by the time you get to these forms, you're almost always at the meeting. And then it's a little late to try to have that conversation. It almost always can't happen. So we try to inform families ahead of time and give them the paperwork and let them know about the parent rep so that they can contact that person. And that person is really usually a good sort of a navigator through this process for families. So next page. Again, just the highlights of this one. You do have to sign here, but this is more of a release so that people can talk to each other. And again, the parent rep is also on this form. We were part of creating the new forms, and we wanted to make sure families had as many opportunities as possible to talk to the parent who's a part of this process with them. The next one talks about the lead agency and some background information. But I think the thing to note with the lead agency, the lead agency is the lead agency who's doing the paperwork. It does not mean that they're taking the lead and they're going to pay for everything. Or the lead agency is often chosen for a variety of reasons. Sometimes it's because this is the person in that agency who the family is closest to or has the best relationship. Sometimes it's the agency where the most difficulties the child is experiencing within that agency, which might be school. Oftentimes for our kids it is, but it could also be in the community or in the home. Or it can be the place where the child is receiving the most, or the child and family are receiving the most services. So it could be any of the agencies that Cindy mentioned are required to be at these meetings. Again, lead agency does not mean they have to pay for everything. And I just want to note that this, again, is this whole process, coordinated services planning process, is about coordination of services, not necessarily getting new services. Although if you put services in the plan, and it's possible for them to be funded, that should happen. And then, again, the names on the bottom of this sheet, it's not, again, about whether you agree with everything. It's just to show who was present and who was a part of the team on this page. And the reason I'm giving this kind of information is these are questions we've been asked by families in the past. And we want to make sure that, that those questions are answered. So the next page 7, or actually page 5, but it says 7 at the top, elements of a coordinated services plan. I think this is probably the most important piece of the plan from my perspective. These are the questions that we want to make sure that families have a chance to look at ahead of time and have some time to think over and come up with their questions, their answers, their concerns. So we'd like families to come prepared rather than last minute. As Cindy also mentioned, oftentimes you get into a big meeting like this and it's a stressful situation. Or, I mean, you may have just left home and tried to get all of your kids off to school everywhere they need to be, and I know what those kind of mornings are like. So, you know, just to be prepared ahead of time is very helpful. Another thing to note is when you're talking about the goals for the child or youth, you're also talking about the goals for the family and the needs of the family. So some of those needs that can be included in here are things like maybe the family needs respite. Maybe they need to build certain skills around helping their child or to understand their child's needs, or whatever those are. The family needs also go in this plan. And that's another thing that's unique from an IEP. An IEP is not about the family's needs, although some of those needs can be mentioned there. The IEP is really focused on the needs of the child. This page is used for brainstorming, using your goals and dreams, your strengths and your child's strengths particularly, and the needs. And I know I found with my child, basing any plan upon his interests and upon his strengths is really crucial for there to be any success in it at all. So it's just really, really important to get this kind of information for those who know my son Josh, one of Josh's biggest interests is horses, and oftentimes we worked a lot of his gaining skills and meeting his needs around using horses as part of that. So keep those kind of things in mind about your own children. So the second page, elements of a coordinated services plan. Just to mention, this is where we list services and who's responsible, the responsible party, and the current status and funding. This is where you're going to put things that are unmet needs as well at some point. But we want to start off with listing what are currently in place for supports and services. And we're not necessarily going to put in every goal that's in your IEP or your 504 plan, but you will be putting in that there is an IEP in place. And maybe highlighting the most important goals from those other plans. You may also have a treatment plan or another plan of some sort. Those goals can go in here, but usually they're more generic around that there is an IEP in place and there are educational goals in that. The party responsible, again, is the party responsible to either bring that information to the table or to do research on where that service can be found or what might be the appropriate service for that child and family. It's not, again, not the person who's going to be paying for it necessarily at this stage. The family members, as a parent, I know I've always well, I want to say always, but there have been a few times where it's not the case, taken on some of the work myself. We're all going to leave this table from this meeting with homework. And our homework and what we bring back and what we follow through on is crucial to our children and our family's success. So we want to make sure that we are following through on those pieces that we said that we would do as families on our piece. Not necessarily researching something that's somebody else's responsibility to do, but there will be some pieces that are ours to follow through on. But life can get in the way, and we're well aware of that. We live in complex situations, and our kids have pretty intense high needs. So when that happens, though, just let your team know that you weren't able to follow through on whatever that piece might be that you couldn't get to. So we're hopeful, when you leave the table that everybody who has a responsible party, you have your homework, that everybody will be doing their pieces. The plan has a better success better prospect of success that way. This page here, 8 at the top, is the elements of a proactive crisis plan. And not every coordinated service plan has a crisis plan in it, and not every child or family needs a crisis plan. And this is only filled out if the team, and you're a member of that team, feels that it's needed. And this is on a side note. I just want to mention this today. It's really not a part of this plan, but the Federation of Families also recommends that families have their own proactive crisis plan. And it may not look like this, or it could look like this. I mean, we can give you ideas of what it might look like, but the plan is really about, so you have information on hand of who do you call in a crisis? Who do you call if certain things happen? If you need certain pieces of information, who do you get in touch with to find that information? So that you have things handy and you're able then to quickly make the calls that you need to make. The other piece of having a proactive crisis plan is, another way to look at this is sort of a self-care plan also, is how are you going to take care of yourself? Because that's crucial. We need to take care of ourselves in order to be the best we can be for our children. Number 9 at the top of this page says appeals process. And this is really just to let you know that there is one, that there is an appeals process for the coordination of services. And this really is just for the coordination of services. So this appeals process wouldn't be for situations like, let's say, a service provider refused to come to the meeting, or that person, actually, I'm sorry, that is what it is about. It's not about somebody not returning your phone calls, or the school is doing this, or mental health might be doing that. There are other appeals processes for those, but this is appeals process can cover things like if a service provider chose not to come to a meeting, refused to, or they didn't follow through on what they said that they were going to do. We always recommend that if you feel that you need to appeal something, that you talk to either your parent rep or you call the Vermont Federation of Families, and we can give you guidance in resolving issues. So this place in the forms, just wanted to give you a very brief explanation of LIT, SIT, and CRC. We have all these nice little letters that we use. LIT standing for Local Interagency Team. Okay. Local Interagency Team, Cindy really already explained those people who need to be at a Coordinated Services Plan meeting. Local Interagency Team can have other members as well, and a variety of folks, and especially since the expanded Department of Education and Agency of Human Service agreement that allowed other disabilities to also use this process. There will be a lot of different people at your local interagency team. Local interagency team is a place where you can get, if the plan isn't following through right, you can make a referral to the local agency team. You can ask for a referral so that they can resolve differences. If there are unfunded needs, needs aren't being met and there's unfunded things that need to be looked at, the local interagency team can do that as well. Take a look at it. I'm not going to say they can pay for it, but they can talk with you and have a team meeting about that. State interagency team sort of oversees the Act 264 Coordinated Services Planning process. And referrals can go to the state interagency team if things have not yet been met, even going through the local interagency team. And parents can ask for a referral to state interagency team or SIT as well. And case review committee is also a referral process, and those forms are included in here. And the case review committee is often about the needs for a higher level of treatment for a child, which might be a community wraparound services, or it might be residential treatment for that child. There's also a parent rep at every level of this process. There is a parent rep, and in this case right now, Cindy Marshall is that parent rep at the state interagency team and CRC. And again, at your local interagency team, there's a local parent rep as well. And parents have a right to talk to Cindy before or after, and often do, referrals to SIT or referrals to CRC. So this next slide is really where the hard part comes in. And the hard part is making sure that the plan is followed through on. So sometimes things go smoothly. Just like with an IEP, sometimes everything goes very well, or a treatment plan, and things move smoothly forward, and sometimes you hit some bumps in the road. And sometimes, parents can walk away and see things not happen that they had hoped to have happen from these meetings. And it can be disappointing and frustrating at sometimes that happens as well. So, I don't want to sugarcoat anything and just tell you that everything's going to be beautiful at this point. But I just want to let you know that it can go either way, just like any other decision we've made, any other plan we've put together for our kids and our families. So some of the things that you can expect after a meeting are the members of the team should be working on their individual task. That includes the family, the parent, or the young adult. Sometimes the youth or young adult have things that are on their plate to do. If needed, a follow-up meeting can be scheduled. You can meet with your parent rep again to process the meeting, or to get some advice again about navigating your piece of the homework. If your team is referring your child to LIT, you will be informed and invited to attend the LIT, SIT, or CRC meeting, or to talk to the parent rep specifically, which again is Cindy for some of these SIT and CRC meetings. If you don't agree with the CSP, you have the right to ask for a referral to LIT. And now we've hit question time, and I'm going to turn this back over to Cindy.
Hi again. Thank you for all the questions. We actually have quite a few, so thank you for your participation, and hopefully that you found all of this informative. So I'm just going to start ask the questions, and then I will answer it as best as I can. And if I don't have the answer, I'm going to tell you where to find the answer, or I will have that answer found for you. I may actually defer to Kathy too to see if I've missed anything. So here we go. Have families been successful in getting a behaviorist for their child in the home through this coordinated service planning process? Yes and no. That's the most honest answer I can give you. It's all individually based for the families. There are individual services out there that are available, like for instance if a child is 3 to 8, or so, you might, there's different service providers and services out there that actually gear towards that group or that disability, so you might have a better luck there. I'm not going to say, I'm just going to be honest. So yes and no. So going through the process is really important if that's really truly what you need. But the important part is the discussion. It's the discussion of the team having that discussion about this is what's needed. This is what I need as a family member. I need a behaviorist to come in. I need these skills to be worked on. I need skills and my child needs skills, and I need a professional with some expertise to come in and help me with that. So the important part is having the discussion of what's needed, and then you can all brainstorm around who can fund it, who is available, who's not available, and so yes, please have the discussion, but I can't promise that through this process that you will get that service, but you will have the conversation. So let's move on to the second. What if there are 2 children in your home requiring services? Now this is actually really truly common, that you have maybe 2 children with very different disabilities and different ages that have different services. So yes, each individual child will have their own coordinated service plan because it is individualized for the child, very similar to an IEP. Although you expand in the coordinated service plan the child's needs and the family's needs to support that child to be successful. So that's what's a little bit different. But if you have 2 children with a disability, then you would probably have 2 coordinated servicing processes and a plan for each child. Okay. Here's a technical question. Where is the part on the parent rep on page 3 of the thing? And that's usually with the blue stripe. There's a blue stripe question, and that's where the checkbox is would you like to talk to the parent rep? Let's see here. Oh, here's a good one. I think she did cover this, but it's really important to just reiterate this, is who determines the lead agency? Because our audience is primarily the families, and this is a primarily targeted training for you, your lead agency is who you would like it to be. And typically you can request the lead agency to be whomever you would like it to be, knowing that that would probably most likely be the person that you have the best relationship with. But keeping in mind that some people may have some informed information out there and don't want to be the lead agency because they're thinking, if I take the lead, then I'm going to have to fund everything that we've talked about or discussed in the process, which is not correct. So you as a family member can say, I would like you to be the lead agency. If they're feeling a little hesitant and not wanting to do that, you can remind them that being their lead agency has nothing to do with funding. It's just about facilitating the process. And you would like them to facilitate the process for you. Okay, we can move on to, here's another technical question, is we previously received handouts with the cover page similar to this, and there's a version 2009 and a version 2007. So I believe you have the most updated, and there's really not a difference, but I'm going to have to defer to Jesse Suter, which is in charge at UVM, is in charge of these forms, and hopefully we gave you the right version, and I can get that answer for you at a different time, but I don't know. And if it isn't the correct one, which I believe it is, we will post it. Okay, and I apologize for that. Can a CSP help a youth who's going to court or convicted of a crime? Absolutely. A CSP actually is helpful in these processes, is to try to coordinate all of the services when you have that. As family members, I can be honest, and as a family support person, is sometimes a diversion or court activity of some kind, probation, they are usually not inclined to partner as well as other service providers. So I'm saying that delicately, if you all can say, can tell. But this is a great tool to be used in that situation, so you can tie them into the team and they can see where there is a team and a supportive wrap and supportive services around that child to be successful. So I think it's, yes, it can be helpful, and it has been helpful for families in those situations. Let's see, I'm getting more and more, so I have to scroll. I think, okay, can a child have a coordinated service plan under the age of 3? Yes, but also we have the Children's Integrated Services process too. This is very similar. So usually from birth to 3, you probably primarily would have a CIS plan around that child. But it's not, which is consistent with a CSP, and very similar. They actually created those from the foundation of a CSP also, but typically that's what happens. But we can, typically what happens with a CSP, it's more geared for the eligibility of if your child's on an IEP or if a child has SED, so that typically happens at the age of 3 or higher. Hopefully that answers your question. I got some more added down here now. I'm reading these cold, so here we go. I didn't get an email with the handouts. How do I get them? So we'll make sure that you get them, and so that'll be helpful. If a child is not an IEP, can there be a CSP? Well, like I said earlier, if your child has an emotional disturbance, you're entitled to a CSP, whether they are on an IEP or a 504 or neither. You're entitled to it. Okay? If you're entitled to it with the expansion, then only a child with the disability, social emotional disturbance, or SED, or ED, would be eligible if they have only a 504. Okay. And then let's see here. Can we talk about, again, who else qualifies for a coordinated service plan? So if we go back to, let's see here, if we go back to the disabilities that are included in the expanded agreement, I can just briefly go over who those are. Those are children with a developmental disability, a medical condition, learning impairments, specific learning disability, visual impairments, deaf or hard of hearing, speech or language impairments or orthopedic, other health impairments, emotional disturbance, autism, traumatic brain injury, deaf and blindness, and multiple disabilities. So basically, if you are entitled to an IEP through any of these disability gates, then you are entitled to a coordinated service plan. But also, too, if your child has a different disability and they have Agency of Human Services and they're entitled to Agency of Human Services, they're most likely qualified. So just ask. Definitely ask. There's no harm in asking. Okay, let's see here. I'm going to read this one. If a family had a CSP before services provided and yet the family is sitting at the table again, should some of the original CSP members be brought back to the table even if the family lives in a different town? Okay, Amanda, that's an interesting question. I would say yes to the answer to that question is everybody that's sitting at the table should be people that are providing services to you currently, and maybe potentially what services that you may need and that are currently not happening at that moment. So you would be living, even if you were living in a different town, you would still be probably in that same region, or maybe even a different region, but you would still reconvene. It can happen, but not mandated. There's the answer. How's that? Hopefully that's helpful. Let's see here. I think those are all of the questions that I could see at this moment. Oh, right. Yes. I actually need some technical assistance to scroll up for the... Yes. Sorry, just taking a moment here. Okay, because there was an interesting question here about, does it follow you after graduation? Okay, does a CSP go beyond high school into college? Well, your CSP actually is probably valid for, I don't want to say probably, it's most likely valid until your child is not in school anymore, which means if they're eligible for special education up and being provided special education until the age of 22, then your CSP would be valid until then. But that is an interesting question, and it doesn't really go into college, very similar to as your IEP doesn't follow you into college. More likely it would be a 504 that would follow you into college. But so I believe that the answer would be no, but I could get some technical assistance on that and get that information out to you. Okay? We can post a list of the questions and the answers on our on the VFN website if you can't get to all of them. If we can't get to all of them. Okay? Sorry. And we have about 5 minutes, so let's scroll back down to see if we had any last-minute questions, and then I think we can wrap up. Okay, where can we get the information on getting a parent rep? Okay, we did, due to confidentiality and the protection of our parent reps, a lot of them actually work from home and out of their home offices. So we don't provide their local information to publicly to protect them in the role that they have. So please, if you want to talk to a parent rep, if you call the Federation of Families, you can also call the Vermont Family Network and say, I want to talk to my parent rep, and they know exactly how to get the hold of, is what they do is call the Federation of Families. We're the clearinghouse and the support people and the technical assistance for all of the parent reps in each region. And we will talk with you about your situation, and we will get that parent rep to call you. And usually we've been doing really well about that. Just about, except for 2 regions currently right now, every region has a parent rep working for that region. And it's so hard to do this when you're being distracted. I'm so easily distracted. I have ADD. But anyway, so basically what it is you can have your parent rep and just call the Federation of Families, call our 800 number, and we will contact you for that. Okay? Okay, Miss Sandy, can you speak about those that are at risk as well? Absolutely. The definition of SED is a pretty wide definition, let me just tell you. Is that they have serious emotional and mental health challenges and behavioral challenges, but then they're at risk of also. So at risk of is really, really, truly important because those little words actually encompass a wider encatchment of services. So if you believe that your child is at risk of certain things, then they're actually eligible. It does widen the umbrella, so definitely ask for a coordinated service plan and use those words, at risk of, and it's really truly important. Let's see here. Okay, so this is a clarifying question. Thank you, Nancy. So a child can be on a CSP if they have a disability in the expanded agreement, or they are on an IEP, or they are on a 504 with SED. Absolutely. Eligibility. Well, if you start with the original eligibility with 88, this is how I understand it. Back in 1988, you had a child with SED. Okay, you're eligible for a coordinated service plan based on Act 264. Okay, any child with SED is entitled to a coordinated service plan, whether or not they have an IEP or a 504. Okay, all I have to do is have severe emotional disturbance and they're eligible. Okay, then in 2005, it expanded to all of the other disabilities. Okay, so all of those other disabilities makes you eligible if you guys have if you're also on an IEP, which would be those eligibility list, and you're also receiving any services from the Agency of Human Services. Those would be examples of personal care services, respite services, maybe a BI. You guys have a behavioral interventionist that is coming to either your home or the school through the designated agency. And I think those are the reasons, and hopefully, Nancy, that clarifies your question. How is it determined who chairs the CSP meeting? Well, again, my audience is, that's very similar to the lead agency question. There's some really great facilitators out there. There really are. People that have been doing facilitating a coordinated service plan for years now. They're really, really good. Typically, those that have been doing it for a long time are those that work for a designated agency or a children's mental health agency. If you're actually, your lead is your school, you may be having some school personnel that may have done it once or twice, maybe a couple of years ago. You know, they're not doing them as common, at least, so they might not be as solid or as confident or experienced facilitating one. But as I said, the audience that we're talking to right now is for families, so you can request who you would like to facilitate that coordinated service plan. You can ask for it. It doesn't necessarily have to be the lead agency either. The lead agency could just coordinate getting everybody there, and it could be a different facilitator that actually is facilitating the meeting per se. Okay? I think we're going to have to wrap up. But if I didn't get to any of your questions, there's a few that I haven't gotten to. We definitely will have it posted on the website. So I just wanted to thank you for your participation. I really hope that you truly found this informative and supportive. And if you need anything from us at the Federation of Families or at Vermont Family Network, feel free to call any of our 800 numbers. We can help you through this process. Okay? It's intended to help you and to help you children move forward. Coordination is your friend. Just want you to know that. Okay. Thank you. Have a good day.
All right. This is Amy again. Thank you so much, Cindy and Kathy. That's okay, Cindy. So there were quite a few questions. Cindy did a great job, and Kathy with getting to them. But we will be posting kind of a list of some of these questions, particularly the ones that we didn't quite get to, and we'll put that on our website right underneath where the webinar posting was. So if you go to the home page and click on webinars, we'll have kind of a list there. And we'll also include, you'll see on the screen right now, there is contact information for Cindy and Kathy and the number for the Federation, but we'll also post this with the frequently asked questions list so that if something comes up for you and you want to call them, you can. And also at the end, when we log out of the webinar, there will be a short survey. So if you put in your email address and fill out the survey, we can email you maybe a list of the questions, and then you can just have them that way. So if you fill out the survey, we'll get that to you. And I think that pretty much sums it up. So thank you so much, and thanks everyone out there for listening, and have a great day.